Come to final BDS MEDC. Classify vesiculobullous lesions and discuss pemphigus in detail is an important 7-marker question from the subject of oral medicine. With the classification, I suggest to write two classifications. So the first one is according to etiology and pathology. Traumatic lesions include chemical irritant, thermal burns, radiation burns due to mechanical irritation, anesthetics, necrosis, and oral trauma from sexual practice. Recurrent ones include recurrent abscess ulcers. They can be minor, major, and herpetiform, recurrent intraoral herpes, and Behçet syndrome. Neoplastic includes squamous cell carcinoma and other tumors. Infections can be viral infections like herpes simplex infections, herpes zoster, hand, foot, and mouth disease, herpingina, chickenpox, infectious mononucleosis, and AIDS or HIV. Bacterial infections include ANUG, tuberculosis, syphilis, diphtheria, lepromatous leprosy. Fungal infections include histoplasmosis, blastomycosis, mucormycosis, cryptococcosis, aspergillosis, allergy, local and systemic. Systemic disorders include blood disorders like anemia, agranulocytosis, cyclic neutropenia, leukemia, multiple myeloma. Cutaneous diseases include erythema multiforme, pemphigus, bullous pemphigoid, mucous membrane pemphigoid, erosive lichen planus, epidermolysis bullosa, and systemic lupus erythematosus. GI diseases include celiac disease, Crohn's disease, ulcerative colitis, and malabsorption syndrome. Connective tissue disorders include lupus erythematosus, Retter's disease, and mixed connective tissue disease. Non-specific ulcers can be Wegener's granulomatosis, midline lethal granuloma, and necrotizing xylometaplasia. Second classification is according to Burkitt. Acute multiple ulcers are acute herpetic stomatitis, erythema multiforme, herpes zoster infections, cytomegalovirus infections, Coxsackie virus infections, ANUG, and allergic reaction. Chronic ulcers include pemphigus, pemphigoid, cicatricial pemphigoid, epidermolysis bullosa, paraneoplastic pemphigus, linear IgA disease, subepithelial bullous dermatosis, and chronic bullous diseases of childhood. Recurrent ulcers include recurrent abscess stomatitis and Behçet's disease. Single ulcers include traumatic ulcer, eosinophilic ulcer of tongue, histoplasmosis, blastomycosis, and mucormycosis. Pemphigus is a group of autoimmune blistering diseases affecting the skin and mucous membranes, characterized by intraepidermal or intraepithelial vesicle or bulla formation. The term pemphigus originates from the Greek word pemphix, meaning bubble or blister. Types of pemphigus includes the Pemphigus vulgaris. It represents over 95% of all types. Variant is Pemphigus vegetans, which is recurrent. Then Pemphigus herpetiformis. Then Pemphigus foliaceus. It is a skin disorder. Phogos salvagum. It is called endemic pemphigus and it is seen in Brazil. Variant is pemphigus erythematosus, then paraneoplastic pemphigus. It targets basement membrane and it is T cell mediated. Then IgA pemphigus and drug-induced pemphigus vulgaris. Starting with the pemphigus vulgaris, it is a chronic autoimmune mucocutaneous disease that frequently appears first in the oral cavity and can progress to involve other sites. It is an uncommon disease. Next is the age. Mean onset is between 40 to 60 years, though it can also occur in juveniles, neonates, and infants. It affects both men and women. Some studies show female predominance. It is more common among Ashkenazi Jews and people of Mediterranean origin, and it is linked to HLA class II alleles. Next is the pathogenesis. Desmosomes are key components in interepithelial cell adhesion involving proteins like desmogleins, that is DSG1, DSG2, and DSG3. Then autoantibodies against desmosomal components, primarily DSG3 in the oral cavity. These autoantibodies result in epithelial cell separation, which is known as acantholysis. Then IgG antibodies, predominantly the IgG4 in active pemphigus vulgaris and IgG1 during its remission. Other mechanisms which can cause our complement activation, protease activation, loss of syncytin 1 expression, leading to acantholysis and spongiosis. Clinical features: oral lesions. 80 to 90% of patients with pemphigus vulgaris develop oral lesions, often the first sign of the disease. Lesion is characterized by flaccid, thin-walled vesicles or bullae that rupture to leave erosions and ulcers. Common sites include the buccal mucosa, palate, ventral tongue, and lips. Symptoms are that the lesions are painful, they bleed easily, and can significantly impair eating. Nikolsky's sign is positive in pemphigus vulgaris, that is, pressure on the blister or normal appearing skin results in removal of the upper epidermis. And it is characterized by acantholysis, suprabasilar split, and presence of Zank cells. Next is the diagnosis. Clinical examination is based on observation of characteristic lesions and positive Nikolsky's sign. Biopsy is best performed on an intact vesicle or bulla, which is less than 24 hours old. Zank smear, identification of acantholytic cells from the base of a blister. Immunofluorescence study shows fishnet and chicken wire appearance. Direct immunofluorescence detects antibodies, usually IgG, bound to keratinocytes in patient's tissue, and indirect immunofluorescence detects circulating anti-keratinocyte antibodies in the patient's serum. Additional tests are ELISA to detect DSG1 and DSG3 in serum, and immunoprecipitation to identify the targeted antigen. Think about the variants of pemphigus. Pemphigus vegetans is a benign variant and it initially affects the vermilion and intraoral mucosa. It has two subtypes, Newman type and Halope type. Newman type is more common. It is similar to pemphigus vulgaris and it heals with vegetation or hypoplastic granulation tissue. Halope type is less aggressive, initial pustules followed by verrucous hyperkeratotic vegetations. Histopathology shows early acantholytic bullae followed by epithelial hyperplasia and intraepithelial abscess formation. Next is pemphigus erythematosus. It resembles seborrheic dermatitis or lupus erythematosus. It may progress to pemphigus vulgaris or foliaceus. Pemphigus foliaceus is characterized by early bullous lesions that rupture and dry to leave masses of flakes or scales, but oral lesions are rare. Then paraneoplastic pemphigus, it is associated with neoplasms like non-Hodgkin's lymphoma, thymoma, or chronic lymphocytic leukemia. Last is the treatment. First, corticosteroids, that is prednisolone, initial dose of which is 1 to 2 milligrams per kilogram per day, orally is given for 6 weeks. The dose should be tapering once the disease is under control. It is gradually tapered to the lowest effective dose to maintain its remission. Second is immunosuppressive agents. As a thioprine, the dose should be 1 to 3 milligrams per kilogram per day orally. Mycophenolate mofetil 2 to 3 grams per day orally in divided doses, and cyclophosphamide 1 to 2 milligrams per kilogram per day orally. Biological agents include rituximab, 2 1000 milligram intravenous infusions 2 weeks apart, or 4 375 milligram per meter square weekly infusions. Adjuvant therapy includes plasmapheresis, typically performed several times a week to remove circulating autoantibodies, and intravenous immunoglobulin, 2 grams per kg over 2 to 5 days, repeated every 4 weeks as needed. Topical treatments include topical corticosteroids, examples clobetasol propionate, 0.05% ointment applied to affected areas, and topical tacrolimus, 0.1% ointment applied to affected areas. Antibiotics are prescribed based on culture and sensitivity tests if secondary bacterial infections are present. Antifungals are used to treat fungal infections, often required if broad-spectrum antibiotics lead to candidiasis. Supportive care includes pain management, with analgesics like acetaminophen or stronger pain medications as needed. Nutritional support includes dietary modifications and supplements to ensure adequate nutrition, especially if oral intake is painful. And last is oral hygiene. Use of mild mouth rinses and maintaining oral hygiene to prevent secondary infections. That's it. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Also hit the bell icon for more regular updates.